Welcome. Please put your name and your affiliation in the chat. We're going to get started in about a minute or so. Thank you, everyone. So for those of you who are joining, please put your name and your affiliation in the chat. Welcome. I'm going to get started in 1 minute. Thank you all for sharing your information in the chat. Good evening. Welcome to the CTSI Building a Culture of Community Engagement speaker series. My name is Estrella Augsburger. I'm an associate professor at BU in the School of Social Work and a member of the CTSI Community Engagement team. We're thrilled to see all of you here tonight. And for those of you who are new to this space, the BU CTSI Clinical Translational Science Institute supports the translation of science into action. So the goal of the CTSI Community Engagement Program is to build capacity among community and academic researchers to work together to advance health equity. The speaker series is a monthly seminar held on the third Thursday of every month with the goal of sharing best practices in community engagement. So the title of our session tonight is Reaching Across Systems, How School Leaders, Police, and Universities are Partnering to Address Youth Mental Health Crisis Response. Our learning objectives are to learn the origins and scope. Sorry, Sorry about that. Learn the origins and scope of a multi-system partnership to address youth mental health crisis, to understand the importance of reciprocity in research, and to describe challenges and solutions in multi-system collaboration. We're fortunate to have 4 panelists joining us in this space to share their experiences in community engagement and research and why it's important in their own work. So I'm going to introduce our speakers. Their full bios are in the chat for your reference. Dr. Andria Amador is Senior Director of Behavioral Health Services for Boston Public Schools. Andria, along with her staff and partners, developed a comprehensive behavioral health model, which is designed to support the behavioral health needs of BPS students. Welcome, Andria. Jenna Savage is the Deputy Director of the Boston Police Department Office of Research and Development. Jenna oversees Boston Police research partnerships with local colleges and universities, as well as internal research projects initiated by the Office of Research and Development. Welcome, Jenna. Jennifer Greif-Green is licensed clinical psychologist and professor in special education at Boston University Wheelock College of Education and Human Development. Her research focuses on supporting students with emotional behavioral disorders and bullying prevention. Welcome, Jennifer. Melissa Morabito is professor at UMass Lowell, and her research focuses on police response with an emphasis on enhancing system response for persons experiencing mental health crises. Welcome, Melissa. So just in terms of the flow of the session, we're going to have a panel discussion first, and then we will have the opportunity for questions at the end. So feel free to put questions in the chat. as we go through the panel, and we'll do our best to get to all of your questions at the end. And so to provide a context for our discussion tonight, I'm going to ask Andria to provide a brief overview to the behavioral health services at Boston Public Schools and their partnerships with community organizations across Boston that serve BPS students. So Andria, I'll turn it over to you.
Oh, thank you. Let me just get my view correct for you. So I just want to acknowledge that all attendees will receive the slides, and there are many more slides on what we're going to talk about, but I wanted folks to have additional information and share the context that these research partnerships can only happen if there are structures within school districts to support it. So we're talking to you about a specific research project today, but that's one of many that my department does in the context of the behavioral health services we provide. So I'm the Senior Director of Behavioral Health for Boston Public Schools. I lead all of the school psychologists and the mental health partnerships. And our aim is really to provide a continuum of behavioral health services to all of the students in BPS. We have kind of a small team centrally to do that, but a very diverse team, which we're really proud of. And we will talk more about the capacity needs in order to have these type of partnerships. But there are a couple of key initiatives that we'll be referring to that I wanted to just set the stage. We don't do this work alone. Internally, we also have a large group of social workers who do amazing work that we partner with in buildings and at the district level. But we also are very honored to have community mental health partners in 100 of our schools. And we come together, and Jenna and I work with a group of 25 organizations that provide mental health services to our students in our schools and in the community. We're also very fortunate to have a very robust and integrated university partnerships with all of the school psych training programs in the state, social work training programs. And through those university partnerships, we do a wide range of things, which we'll refer to here, including the research that we're going to talk about. And we also have very intensive workforce development initiatives, a huge federal grant we're happy to get, and our university partners received it as well. We have a very large training program, the largest school psych training program in New England, and we do a ton of PD. And again, all of that research impacts this work. And we are the only department in the district that has its own internal research team. And that's the team that has been working with these partners to do that. And that's pretty unique and gives us, again, the infrastructure to do that. My department has a large range of community partners that are integrated into all facets of the work we do: university partners, professional organizations, community partners, hospital partners, mental health partners. So again, in the PowerPoint, it gives you a sense of some of the things we've done with those university partners, and research is a big part of that, both our own internal research and supporting the research projects of university students. Again, we have a wide range of partners that we do this work with. So none of this research and collaboration can happen in a vacuum. And at the end, I've just given you some information about our department. So I'm going to stop sharing because we do want to get to this specific, but we as a team felt that it was important that people understand that this work falls in a broader context that took 15 years to develop. It doesn't happen overnight. It takes a lot of dedicated work by school staff and partners to make this happen. So thank you for letting me set that stage.
Thank you, Andria. And I also, if you could just talk a little bit about sort of how your relationship, with Jen and how the relationship around this research was formed and why you felt it was important to partner with academic researchers.
So I'll start globally. Why is it important to partner? As a new administrator, I recognized right away that my department was not designed to meet the needs of kids, that my staff and our department were not using evidence-based practices to do our work, and we were kind of stuck in the past. And so the very first people I reached out to to do better were university partners. And they stepped forward immediately to say, we're going to help you make a difference. And then when we realized that we had to improve not just our own personal professional practice, if you will, that we had to do systems work, we reached out to mental health partners and lots of partners and said, who's going to help us do some systems work? And that's when Boston Children's Hospital stepped forward. So throughout this evolution of the role of school psychologists and the role of our department, we've only had, every success we've had is in partnership with a very close integrated community partner. And again, it started with universities and hospitals, and now we work with city agencies like Boston Police as a proud and important partner, emergency medical, best team response. We have partnerships across state, local, and national. And so that's kind of, it started out of need. But it grew because we worked very intentionally to have mutually beneficial relationships that support the other organizations and their needs and our needs. And once you start to kind of focus yourself on creating networks, professional networks, one thing leads to another, to another, to another, and that's how you meet people. So Jen and I were connected through former employee who went to another district, and she ended up in the university. You know, that's how those things happen. And Jenna and I have had the pleasure of knowing each other for years. And it's because Jenna reached out and said, oh, I want to help. And I'm like, I need help. And Boston Police was actually one of our very first partners in doing better mental health and work, was Boston Police, because they want students to get quality mental health services. And so one of my first partners was Boston Police. So again, it's about, through creating networks, reaching out your hand, asking for help, and then people really giving the time to connect. And Jen, I'll speak specifically about Jen. Like, she came to us. She's a gift. I always say how grateful I am to have met Jen. And one of the most important things I'll say is the willingness to help solve a problem that immediately may not have a clear gain. And Jen said, I'm going to help, and I'm going to learn, and then I'm going to figure out how it's mutually beneficial. But her first step isn't, I'm coming to you to ask for something. And that was really important. And now it's blossomed. But Jen and Jenna, and it's through Jen and Jenna that I met Melissa. So I'll turn it over to the rest of them.
Yeah, I think maybe Jen should talk next, since the order of things, it was kind of a domino effect. And apologies in advance, Melissa and I are in Philadelphia together for a conference, which is why we are in person. We're actually presenting on some of this research while we're here, which is why you see us sitting here together like this. But maybe Jen should go next and talk about your relationship doing research with the schools, and then how I got brought into it, and then how I brought Melissa.
Fabulous. Thank you.
Sure, that sounds great. So I'm a professor at BU Wheelock in the College of Education, and my research is on school mental health services. So I've been working for a very long time doing research on school mental health services, but when I was tenured, I had some space to really step back and think about how I wanted to move forward with my program of research, and had some more flexibility than I'd had previously to do that. And I reached out to Andria and talked to her about some of the work that I have been doing with other school districts to support them in their school mental health service delivery. And the work has been almost entirely focused on systems level change and thinking about systems to address inequities in mental health service access. So I reached out to Andria and told her about some of my work, and she told me about the Behavioral Health Collaborative, which is described on one of the slides that she went through, and she invited me to come and sit in. And so for about a year, I just sat in meetings and listened to how community partners were talking about mental health services in schools and what they saw as challenges that they were encountering, and strengths of their work together. And it was a great opportunity for me to learn about what was happening, and I had the space to really just sit and to listen to what they were saying about school-based mental health service provision. And then this particular project that we're going to be talking about today is just one project that's kind of grown out of our partnership, and there are several others, including partnerships, including research that focuses on youth and on teachers and on families. So this is just one specific project. But this one came up because I was sitting in those meetings, and there were questions that were coming up in the meetings among the collaborating mental health providers about police response in schools, and questions about how school-based resources could better support the mental health needs of students and reduce the reliance on police and reduce the number of calls to police. And so that question came out of discussions that I was spending a year or more just listening to for a while. And it was a question that I then brought to Jenna. So maybe I'll turn it over to you, Jenna, to share kind of your part of the story.
Let me know if you can't hear me okay. Yeah, I basically got a cold call from Dr. Jen Green one day, and I can't remember if it was an email or a phone call, but wanting to know about, I think it was calls for service data about police response in schools. And of course, it wasn't something I had ever really thought about, but I was super interested in, particularly because I had been for the past 10 plus years focusing, like my passion project at the Boston Police has always been related to mental health. And so I'll give that background in a second. But when Jen reached out and said she wanted some information, rather than just provide information, I would have rather, and what I did was say, well, what can we do together? What can we look at? What kind of data do we have? And how can we answer this question? Because it would benefit not only schools, but the police to understand what's happening and to take a closer look. And if I was going to be doing that, I was of course going to bring in my academic partner, who I've been working with for over 10 years on all things mental health with the police, and that's Melissa Morabito from UMass Lowell. So it immediately became a partnership across UMass Lowell, BU, and Boston Police and Boston Public Schools. And it's just been excellent ever since. Honestly, we've been looking at a lot of the Boston Police data, but just for my own background, I'm the deputy director of the Office of Research and Development, which technically has nothing to do with mental health. But one of the things that I do a lot of is I apply for grants and I manage grants. And, you know, grants are what allow you to do kind of innovative work. And so starting in 2010, started applying for grants related to mental health, largely focused on a partnership between the Boston Police Department and Boston Emergency Services Team, or BEST. And it's through those grant funds that over the years, we've developed a huge co-response program in Boston that now has investment from the city of Boston. But again, that all kind of started with grant funding, and it's just been my own interest to stay involved. So in all things mental health, I'm heavily involved with the street outreach unit, with our new CIT training, with our peer support, with safety net, kind of everything related to mental health. I try to get funding for, but not just that, but I like to be involved and coordinate. It just is my favorite part of my job. It's just what I love the most. And so in research, you know, I do have a background. I got my PhD in criminology. And so I do also love data and research, and I can kind of speak that academic language while also understanding police language. I am a civilian, I'm not an officer. But so I just kind of straddle both worlds. I love answering questions, and I love, you know, just making things better. And, you know, and I also got to know the school police unit better during this work, and understood that, you know, they also needed this help. They didn't want to be, you know, they don't want to be arresting students. As Andria said, they want to be making sure students get the services they need and the right outcomes. And so it was truly to everyone's interest to kind of find out what's been happening and how can we possibly see what needs changing, or see what you know, do we need more resources? What can we do? And so it's just been a pleasure doing this work. And then I'll let Melissa introduce herself.
Okay. Hi, I'm Melissa Morabito. I'm at UMass Lowell. I hope you can hear me okay too. I'm also kind of in a unique position, working for the state, working for UMass. I have a little bit more flexibility, right? My research and service can kind of collide, and I love that. I can give my time, and I mainly work with Boston Police, but I have also done work with Lowell. I do some work with Somerville, and it's a nice opportunity, right? So any police department that is looking to sort of say, what are we doing around mental health? Police departments are a wealth of data. It's typically used for business purposes and not for research. And so we're figuring out how to do that, right? And how to measure change, right? There's all sorts of innovative and great stuff happening. But if nobody knows about it, right, then we can't learn from it. So I was really excited to be brought in here. I originally had interest in children, right, and justice involvement. I actually have my MSW, and Andria and I were in an MSW program together a million years ago when dinosaurs roamed the earth. Yeah, so this has been a nice kind of homecoming for me as well.
Thank you all for sharing. I just want to kind of elevate. I really appreciated how Jen, how you talked about the space to sit and listen and really sort of hear from the community, hear what their priorities were, and sort of develop research questions and a research agenda around that. And I think that's a really important component of community engagement, especially as researchers, to be able to really take the time to develop that relationship and to sit back and listen to what the community wants and what the community needs. And I also really appreciated then how you all talked about, reaching out to different agencies and to different partners and really trying to sort of collaborate and understand how can we all collaborate and work together to, to address youth mental health crisis response. And so I'm going to ask if Jen, maybe you can talk a little bit more specifically about sort of the research agenda, like what is the research that you all have been focusing on? And yeah, I'll start with that. If you can just elaborate a little bit more on the research.
Sure, and of course, anyone else feel free to jump in, because this agenda, it was not one that I designed on my own. This is a co-designed agenda. But the initial questions that we were trying to answer first were, we had some very foundational questions about how often police were being called into schools or were going to school addresses, and when they were going, and in terms of kind of time of day and day of the week and month of the year. So there were some really kind of foundational questions, and how those calls were distributed across different schools that we were curious about answering. And then kind of second, we were interested, I was especially interested in what the precipitating events were that led to a call to police. So I've been very interested in what's happening in the school that led to a school staff member making the decision to call on police, and related to that, what could have been done prior to calling police instead, or what resources could be put in place instead to support students that could reduce or prevent the need for a call. And then Melissa, your main question kind of dovetails with that, so I'll turn it over to you.
Okay, so I mean, I'm more interested in understanding police decision making, right? And so what, in terms of like what kind of information informs how the police make their decisions in all types of mental health incidents. And I've done most of my work on looking at police decision making around adults. And so I also was interested to see if it was the same sorts of things for young people, and particularly around juvenile justice reform in Massachusetts, where children under the age of 12 are not going to be justice involved, right? And so what is happening with that population, and what is really the expectation if police are called? What is the hope that police will be able to do something in that? And just to be clear, I think it's good reform that children under 12 should not be justice involved, just to be clear on where we stand on that. But how does that alter the outcomes?
Could I jump in and give a shout out to Sergeant Sexton, who worked with Jenna and I at the time that we did this work. He, again, was one of my first partners from the Boston Police School Unit. And he and I really felt this work was important because we were both trying to prove that if we had more mental health staff, students would get what they need faster. And Tommy, Detective Sergeant Sexton, I always joke he's my favorite social worker, even though he was not a social worker. He was a a Boston police officer, but he knew that it was his job to get kids help. And so I just want to say, like, there was a need at our level, and then our researchers and partners came in to help us, and our need was proving that we needed more capacity, both in BPS, but Sergeant Sexton was also trying to prove that the police needed more help. And the mental health ride-alongs Jenna was talking about, this data helped both sides prove that this was important and was going to work. So it's not just doing research for the sake of research. I need to keep naming that over and over and over. It's like meeting a need and then using the data from the research to help us support that. Thank you. Thanks
for sharing that. And if any of the panelists could sort of elaborate on that a little bit. So you're sort of talking about the translation of the research into practice. Are there, can you provide some examples of sort of how your research has sort of translated into practice?
Jenna looks like she's gonna go.
Hey, Andrea. You know, I can't say it's changed. So many contextual factors have changed. And that was actually part of the most interesting part of this research, is that Melissa was looking back for her email. We started in 2018. That was pre-COVID, and that was pre-police reform. So back at the time when we were starting to do this, there were, we didn't call them school resource officers. We called them the Boston School Police Unit. And so that was, it was just an interesting time, because the context, so again, this research is ongoing, but as far as reform, policy changes, unrelated to our research, very naturally, there was a change that police reform happened, and then the Boston School Police were disbanded. And so this was a major change. We still have, the Boston Police Department still has a school police unit, but very widely, the attitude towards police in general and police in schools has changed as we've been doing this research. And there's been a large push. In our papers, we often talk about how for a long time, given school shootings in a lot of contexts in a wider area, there was for a long time an increase in security in school. And then in more recent times, there's been more of a push for getting the police out of schools. And so, as these changes are happening, I think one thing that people often overlook is that whether there are police officers assigned in schools or not, schools do call 911. And so, when you've got all these different schools throughout the country increasingly disbanding their school resource officer programs, no one's really looking at how often schools call 911 and the possible impact of, it's quite possible. We haven't had a chance to look at this, but I'm pretty much the most excited to look at this, is what was the impact of disbanding the Boston School Police Unit. Did that lead to an increase in calling 911? And the school resource, the school police are at least people who recognize the students, know the students, are familiar with them, they're known to them, they have the context. Whereas now when you call 911, you're hopefully getting the Boston School Police Unit, but it's a very small unit. So you're also probably more likely to get just a field officer who doesn't necessarily have special training in youth, mental health especially. And so we haven't really seen any specific policy changes yet on the police side from our research. But I think the more we can find out, I think we're still really honestly in the finding out phases. We did the initial stuff that Jen talked about in terms of looking at when are calls coming from schools most often, and for what types. And we're just about to kind of finish looking at the outcomes of these calls. So much of it is complicated by school-based factors that we haven't really had a chance to look at yet. But we do know, and one thing we have unequivocally found is that, yes, resources, those schools that don't have that comprehensive behavioral health model, they call the police more often. That is a thing we know. And so that is what we are trying to do from the get-go with this research, is truly just make a case for, if the schools have better resources, then they don't need to call the police. It will always happen, and the police will be needed. It's a thing, that is I think a fact. But the better resources there are, the less reliance there is, especially for students under 12, who there isn't even a criminal justice option for, and yet police still get called. In fact, we find that they get called a lot for children under 12. And so I think there's going to be a lot of room for policy change on the school side, on the police side. I think there's a lot to learn. We're learning a lot about calls related to sexual assaults. I think there's going to be possible changes in, even just school policies. They all have a real impact. I don't think we've had really the opportunity yet to translate our actual findings into policy changes, but I think there's a lot of potential.
Well, if I could add though, I don't think you're giving this work enough credit, because good research doesn't happen in a vacuum, right? It happens in the context of other things happening. So again, we've used this project and related projects happening to advocate for the police having their resources, for us having ours. But it also led to very robust conversations with some more procedural changes happening, like police notifying schools if a student was involved in something serious, like they happened to be on the scene of a fire, something like that, then we're notified. Like these discussions are the discussions about this research sat within a team that was also having conversations about procedures and practices ongoing, and those did shift. Was it directly as a result of this particular study? No, it was part of the group that was doing this study and thinking about other things. And so again, taking it broader than this just one study to our research, larger research initiative, it's coming together to say, what are the problems we're trying to face? Who has the expertise? And how can research help to address the need? So it's driven, I think, the most successful projects that we've been part of are projects that are born out of, like this was, born out of a need that a group was trying to solve. It wasn't like someone sitting alone at the university saying, what do I want to think about today? It's coming together as a group and saying, what are we trying to tackle and how can we do it? So I think it's been really, really effective. And I too, like Jenna, am excited to do another group of studies to see what is the impact post-COVID, post-police reform. But also when we first did that study, we had about half of the mental health capacity that we have now. Now we have more than 350 mental health providers in the Boston Public Schools. It's something to celebrate. And through the years, all of these partnerships and data and research is what we've used to advocate to go from when we started in 2007, I had 48 school psychologists and 6 social workers. I had 54 mental health staff for 60,000 students. Through all these years of partnerships, research, and advocacy, we now have 250 social workers, from 6 to 250, and we have 109 school psychologists and mental health partners in 100 schools. So it's time to do more research to show the impact of all of that and how that relates to the increased mental health needs post-COVID.
I'll just add also that whenever we're writing a paper and doing this work together, we're bringing it back to Andria and back to the research team that's at the school, and bringing it to Sergeant Sexton and to Jenna to develop the implications. So the implications of our work and policy implications are not pieces that Melissa and I are sitting around and coming up with on our own. We're bringing it back to the folks who know the context and know the schools and can help us to make sense of the data and what they mean. And we, for this project, or one of the projects where we coded police incident report narratives, we brought onto our team a school psychologist and a social worker from BPS who helped us to design our code book and helped us to figure out how to code the data. And they were really, they're co-authors on our paper. They were really involved in the process because it was really important to have their perspective and the information about context from them.
That's really helpful to kind of hear a little bit more about sort of how you're partnering and how you're leveraging sort of the expertise of all of you and also the broader community in terms of bringing your findings back to the community and helping them to sort of inform the practice. So as you were talking, I was kind of thinking about bringing together sort of all 3 of these different agencies. Can you sort of reflect on some of the challenges that you've encountered in your work together and sort of, yeah, what you've done to overcome those challenges?
I mean, first off, I would say that most of the data we're using are administrative data, and they serve a very important purpose for the agencies, but they are not created for research. And so just being able to translate into research is important. And also, just because the data says something, right, doesn't mean that that's how staff are using it that way, right? Like I look at like nature codes for the police department and I'm like, okay, but what does that mean? Yeah. Right? Like why does that get assigned a nature code? Why does it get closed out that way? And so part of it is also back to what you were saying before about the collaboration. I think a big piece of it, and something I've been hearing a lot at the conference that we're at right now, is kind of coming in without any kind of judgment about what the intentions of the folks in the agency have when they're doing their work, right? To not assume either good or bad intentions, but to try to understand, right, like where they're coming from when they make those choices based on the resources that they have.
Can I ask another follow-up question to that? So you're talking about the, the agency data maybe not being designed for research. Sort of, how did you overcome that? How did you do that? And also, I wanted to ask a question about, like, how do you share data? Sort of what were the steps that you had to take to sort of share school employees' data?
Well, mostly all, I mean, I guess I can say pretty much all the data we've used so far has been police-based data. It's been calls for service data, which is 911 data, and incident data, which is kind of different because not every call results in an incident report being written up. And the incident report is neat because it has a narrative, so it gives you that context. But it takes a lot of time because in order to share data, I need to redact everything. As you can imagine, this is extremely sensitive data. It's all involving minors basically by default. And so I guess the way we overcome that is through me just redacting everything. I guess when you bring someone to the table who just does have direct access, and it helps that we got a grant through the BU School of Social Work that was able to give me time to spend that time and do it, because we were able to do a data sharing agreement. But especially as someone, I mean, it's just because I have an interest in this, B, have direct access to the data, and C, happen to be the person who oversees research through my department. I was really able to kind of make sure we got the data sharing agreement in place with Jen and with Melissa, and to personally ensure that everything was de-identified first. It's going to be harder beyond that because we don't have a me equivalent on the school side. And so, so far all the data really has been mostly police-based, which is interesting, but of course there are so many variables that are school-based that we would love, and that is a challenge, is hopefully, and I know that there's we need to improve information sharing, I think, between schools and the police, and I know that is actively an effort that's being made right now that I'm not privy to. That's way above my pay grade, but so I think that challenge is one that has definitely been identified and that's being worked on. But for now, the data has been pretty much entirely police-based, and we have access to it, and we're just doing with it what we can.
Can I add to that, Jenna, that the other part of the data is who are the schools that they're going to, what is the makeup, who are the kids, what's the staffing in it. And one of the things that was really interesting as we did this together is unless someone can take that data and contextualize it, it could lead to a lot of inaccurate understandings of the data. So for example, if we have a school that has a specialized program for students with emotional impairment, it may be that they're more likely to receive a police or call for help, right, than maybe a small school with no specialized programs. And that's the part where we come together and we can contextualize that data as a team. But the other part, there's a couple of other challenges that I want to name from the district perspective. Being in Boston, we're surrounded by universities, so there's lots of folks that want to do research. And so we're overwhelmed with requests for that. And Melissa said something important. University professors get to count this as part of their job. It's part of their job. It's not part of most school administrators' jobs. Mm-hmm. So I've been criticized by administrators in the past for spending too much time working with partners or outside the district. And my defense to the way I do my work is I can bring more to students in BPS if I partner with people than if I just stay in my office by myself. But it's not, there's a huge capacity challenge, right? We don't have enough internal capacity to match all of the research needs at a bigger, broader level. And so then that's why I have to pick and choose partners who are going to do these other good partnership things that I hope we have more time to talk about. And the other part that Melissa and Jenna are so wonderful about is like, and you just referred to this, Melissa, not coming and saying, I want to do this, but coming and saying, where's the need? Let's figure it out together. And then putting it in the broader context, because otherwise it's a challenge of people just doing desperate kind of research projects and hoping that the district will buy in. And when we have such limited capacity, we can't do that. So with this project, it worked so well because we didn't have to address those barriers because it was an organically developed project.
Andrew, you've been so awesome to work with. And I will, without going into details, I'll say one challenge is always going to be politics. And the BPS is complicated, BPD is complicated, everybody's got their stuff. And so even when you've got people who are just really interested and ready to do work, it's just never that simple either. And there's just these are big organizations that are complicated, and there are hierarchies and chains of command, and I'll just leave it at that. But it was just, nothing is simple. And so I think that we've managed to accomplish a lot of great work already, and I think we're going to continue to do so. But it's, there's navigating that I think needs to happen, and that's just always going to be a challenge.
Yeah, it sounds like, it's really, and Andrea, I will say too, in knowing you and in knowing all that you have accomplished sort of in your role at BPS, it truly is remarkable. And I think your interest in research and your desire to sort of think about using that research to really improve services is really powerful. If you can reflect a little bit more on, like, you talked a little bit about sort of the capacity and the buy-in, like what does that look like for you in terms of sort of your role in like getting the buy-in to be able to do this research?
Yeah, well, a couple of things. I'll come back to the structure. We are, for us, it all started with universities, and as I mentioned, they helped us become better, both at our professional level, but also at the systems level. So we've been doing systems level change for so long with the partners that now we have many structures that support this. So one, I am a doctoral level school psychologist. We're lucky in Boston that school psychologists are supervised by school psychologists. So I do have maybe a bit of an advantage in that versus some typical departments may not have that capacity. But because we've been working so closely for so long with universities, one of the things we've created is that internal research team that has university partners like Jen and Melissa Perot from UMass Boston, Brian Daniels from UMass Boston, Achilles Bardos from the University of Northern Colorado. We've been working with partners across the nation for quite some time, but we also have hospital partners, Children's Hospital, Dr. Charlotte Dennery. So we have this structure for these people to come together and do this collectively. And I mentioned we're the largest school psych training program. We also have students who are doing their dissertations. And it's, again, one of those connections where the research can be supporting the students' development, supporting the department, supporting the professors. It's mutually beneficial. But I believe in that, in bridging that research to practice gap. But what's been successful is finding partners that have a shared philosophy where they feel like it's their ethical and professional commitment to work with school districts. And for me, understanding the value that they bring, I think both partners have to have that perspective. One of the reasons it was important to me is because I knew I had to have a highly trained staff to do this complex and broad behavioral health work that we're doing, and that we had to upgrade our practices to be culturally responsive. So there was that was my initial interest, and from there it's grown into the things we've talked about. But the reason that I continue to do this work, obviously we continue to need to enhance our practices and train our staff, but we continue to need this research to prove that it works. So as Jenna said, we work in complex organizations that have multiple systems change, multiple leadership changes. I'm quite public in telling people I'm on my 35th boss. And so I need to continuously prove that this work matters. And so having this outcome data, which is my primary need to prove that comprehensive behavioral health improves student outcomes. We've proved it year after year after year doing this research, that increased capacity improves students' lives, like Jenna had mentioned. And so that's why I continue to feel like this is an essential part of my job, because we can then have that data. For example, Mayor Marty Walsh was a huge supporter of the work that we were collectively doing. And he, one of the final things he gave us was 25 school psychologists, because we could prove to him that this work mattered and made a difference. So outcome data is really important. I know we're talking about a specific research project, but that outcome data is what all of us need to prove that this work matters.
Thank you. And Jenna, do you want to reflect at all about sort of your role within, Boston Police? Is this unique? Is this a unique position? And sort of how do you get that buy-in?
I guess, I mean, I do think my role is pretty unique. I definitely take advantage of it. And like so many other partnerships, I mean, I do think that if I were to leave tomorrow, this wouldn't so easily continue from the Boston Police side. It's definitely been kind of individual heavy. Like Tommy Sexton, who Andrea mentioned, he's gone now. He retired, and I'm happy for him. But he was such a huge key player, and with him being gone, it kind of remains to be seen what will the relationship be with the school police unit, which I believe changed its name. I don't even know. But so things are difficult when they're so individually based. And so as long as I am here, I will make sure that this continues, and I will try my best to try to ensure that it would continue if I were to leave. But I don't know if I should be admitting this. A lot of the work I do because I'm interested in it. I don't think I'm not being told to do this. I get full support for it, for sure, especially from the school police unit and from our street outreach unit. I mean, the support is huge, and we're probably going to be getting another co-responding clinician from BEST to go into the school police unit again. Very excited about that. The work is highly supported, but it isn't driven outside of me, if that makes any sense. So, for me, I do feel very lucky to be in a position where I can do what I do. And as I've said, it is by far the most gratifying part of my job. The co-response program, like that's something that I know if I were to leave tomorrow, that is up and running. That is a part of the fabric of how the BPD does its mental health response. Like I know that is institutionalized. This partnership, I do think, is from the BPD side heavily invested through me, but I'm not going anywhere, so I'm not too worried about it.
I like to describe Jenna as a force of nature.
Yes, it definitely sounds like it. And Jenna, it sounds like also you're establishing some sort of you want to have sustainability, right? And
Absolutely.
So it sounds like you are sort of thinking about this and thinking about the partnership and how you might sort of grow it, maybe beyond an individual.
And that is also so much of the data. And that's how we were able to, again, even just institutionalize our co-responder program. The data is how you kind of prove that something's worth an investment. And so the more we keep doing, the more we keep publishing, the less need there is. I mean, research will always be important, but I think we're doing a great job now. And as long as we continue to keep doing what we're doing, I think the data will continue to speak heavily for itself and make our cases for us.
Yes. I want to open it up now to the audience so that we can have an opportunity to have a little bit of a dialogue. Does anyone have? You can post questions in the chat, or just come off mute and ask your questions of our panelists. Any questions?
Hearing none, Estrella, or waiting for people to formulate the question, I
Sure.
can jump in to build off something important that Jenna said, that all of this work has happened because of individuals, people's passion. But what we can each do within our organizations is to codify this relationship in strategic plans, in changing job descriptions, in identifying funding streams and moving those funding streams from grants whenever possible to hard money, if you will. Those are all things that we're trying to do across each organization. So when I leave, there's still a research committee, there's still a doctoral training program, there's still the expanded role of school psychologist. And another way that we've tried to make that happen is to ensure that our school psychologists know that they're leaders. They're not just mental health providers, they're leaders. And so when I leave, I know I have 109 people that know that this is their new role and they're going to continue to fight and carry the mantle as I go on. But I think Jenna raised an important part. A lot of these sometimes great, or a lot of times great work happens because people are really committed and they put in that passion, but then how do we shift it from people's passion to organizational structures that continue? And Jen's helping me do that with the collaborative and also within my own department. And Jen, I'm going to turn it to you because I know you've also worked very hard to get the university on board with that as well.
Rebecca, Jen, do you want to reflect on that? Do you want to?
I guess I'll just say briefly that I agree that this has been a highly relational partnership, that we've spent a long time building relationships with each other, and building trust among our group has been an important piece of this. It isn't work that we were able to jump into quickly. It took many years for us, I think, to get to know each other and to build relationships, and we don't always agree on everything when we're writing drafts. We have a lot of drafts back and forth where we're editing and writing different things, and coming together around what messages we want to put out as a group. And that's a really important part of this process as well.
Thank you for sharing that, Jen, because I think that's also a really critical component of the community engagement, like everything that you're talking about in terms of like the time that you've mentioned a couple of different times, the time to build that relationship. And then also, Andria, as you and Jenna are talking about, like, it can't just be an individual. There has to be sort of these structures that are formed around to really support this sort of community engaged research. So these are critical aspects of community engagement and research. Rebecca, I'll turn it over to you for your question.
Yeah, thank you. And thank you very much for the speakers coming this evening. And I apologize with my clunkiness. I couldn't find my hands up option for some reason. But I'm curious, often in community engagement, we involve the people who are directly impacted by our research. And clearly you're involving the school system, but I'm wondering if you ever involve children or youth as partners, more accurately, youth as partners in your research, and what that might look like.
I can start and then others can jump in. So from the very beginning, our initial development of our project, which is the one of many, is the comprehensive behavioral health model, we went to stakeholders and said, we know we need to do better. What do you need from us? So principals were surveyed, children were surveyed, parents were surveyed, teachers were surveyed. And then when we, for example, when we used research and partnerships to figure out, one of the missing links were universal behavioral health screening. Every year we screen kids' eyes and their hearing and their vision. We weren't screening their wellness, their behavioral health wellness. We needed to do that. We went back to those stakeholders and said, give us feedback. What are you looking for? We used research to pick 3 tools, but we piloted those tools in 3 different schools and went back and said, which tool feels right for you? That was many years ago. So during COVID, we're like, we need to pause and review our work and make sure that it's social justice forward, that it's culturally responsive, that it's relevant, it continues to be relevant. And through that stakeholder process, it became clear that we needed to do more of student self-assessment. That our students were very clear with us. I want to tell you about my mental health. I don't mind if my teacher or my parent does as well, but I want to tell you. And so we shifted, and now our middle and high school students are doing their self-reports about their mental health. So those are just a few examples I can say in general, but I know Boston Public Schools has made a very big commitment to getting stakeholder engagement in general. So I'll give the district shout out, but for our work, we've been very intentional about this. And it's actually why we've had very little resistance to changing. We're a very strong union city. School districts are very strong unions. Our school psychologists led this work. So none of them said, I don't want to do this work. They were our key stakeholders in changing their own jobs. Our teachers were our key stakeholders in developing what this behavioral health model was. And when you do the work with the stakeholders, it's collective work. It's not Jen's work and Melissa's work, and they tell me about it after. It's our work. And so then you don't have to worry about buying because it's co-constructed when you're doing that authentic stakeholder engagement.
Thank you very much.
Any other questions for our panelists?
If she can just, hi, Ebony from Cincinnati Children's Hospital. This is a great discussion as we talk about this type of work. Could you build upon a little bit about that whole cultural structure that you put in place, and how did you do that with different types of ethnic backgrounds? What were some of your key focuses of doing work such as that?
I'll give two examples and then turn it back to the team. One of the most important things I've had to do is diversify my workforce. So I can't be culturally responsive if the field of school psychology is 80% women and 90% white. You can't be culturally responsive if everyone's the same. So we've spent 15 years diversifying our workforce, and we're very proud that our mental health workforce much more represents our students than the national averages do. So that first and foremost is who's at the table. And then it's getting feedback from all those stakeholders to learn more about what's important to them, the families, the communities. So when we're doing research with partners, we like to say, like, equity is action. Equity isn't discussion. So we're really saying, this is important to us. How are we going to braid equity and social justice into all of our research, all of our interventions, all of our discussions? And so I could get a little bit into the weeds, but workforce diversification was one. Very intentional and specific training on equity and social justice for all of our mental health staff is another example. A third example is reviewing all of the curriculum with a social justice lens and saying, is this still represent the values of our community? Bringing in bilingual materials, creating procedures for working with families of color and bilingual students. We've been very intentional for several years, so it's deep and broad, but I know my other partners have as well, so I'll pass it to them.
Yeah, I mean, I'll just add that I'm involved with a new project that's being launched out of UMass Boston, and UMass Boston is a really great research partner for BPS, the Behavioral Health Department, and the initiative is focused specifically on multi-tiered systems of support, the comprehensive behavioral health model, and how to make that model a more culturally responsive model and advance equity in the use of that model. So that it's a team that's coming together to look at different aspects of the model and its implementation and fidelity assessments, and trying to support the district in redesigning what that can look like and using it in new and different ways.
Andrea, I wonder if you could also share your the pipeline DOE grant that you just recently received. You talked a little bit about diversifying your workforce, but I think part of it is that you're also bringing in students to sort of, as a pipeline to employment. Could you briefly talk about that?
Yeah, I've already invited myself to come back to talk about that. We're super proud of that. We're one of the few school districts that received the grant. A lot of the grant has been given to universities and community partners, but we can stand on our own and with partners, and we're really proud of that. So we received a very large federal grant to help us in our diversification and workforce expansion initiatives. So our focus is increasing the amount of mental health professionals that are people of color and bilingual, but also that we're collectively working on workforce development. So it's not that I just care about training my school psychs. I care that my kids who are seeing community partners, they're well trained as well, and that the university students are getting great field experience. So working across community partners, universities, and the district, we're training 50 mental health professionals each year. We're giving them great field work, great supervision. As new hires, they'll get mentoring. And collectively, that group of almost 600 people, if you add community partners and internal staff and university students, we're talking about 600 of the City of Boston's mental health workforce are now getting free training every month from this grant. And we couldn't wait for bilingual people and people of color to apply to my positions, because guess what? There's not enough people applying. I had to go out and create a training program to attract them to the district and then hire them. Like, I know about a bilingual student when they enroll. I don't wait for them to apply at the end of 3 years. I'm courting them when they enroll. we're training them, and then we're hiring them, and our university partners are doing the same. They're being very intentional about trying to recruit students. We're working on a national project called the National Association of School Psychologists Exposure Project, where our mental health staff are going into our BPS middle schools and high schools and talking to our students about the field of school psychology and saying, we want you to be the next generation of school psych. And I now have three school psychologists that were BPS students, and that's just the beginning, because workforce development takes time. But we'll come back another day and tell you all about the grant.
Thank you. Thank you so much, Andrea. I want to, being cognizant of time, I want to end by saying that the recording will be available, and we will also be sharing resources with you in a follow-up email. I'll end with this, with Mary's words, which is, as a longtime Boston resident and BPS parent, I am so grateful for your work. So thank you all so much for your amazing work. And we are so appreciative of you coming and sharing with us today. So thank you so much. Everyone have a wonderful night. And we are going to be taking a break in December, and we look forward to seeing you all in 2024. Good night.
It's a nice Friday.
Thank you. Good night.
Good night.